3 common over-the-counter medications that you should avoid if you are hypertensive. One of them is your decongestant, especially those that contains phenylephrine or pseudoephedrine. These are wonderful molecules for you when you're having nasal congestion. You imagine what it is. You can't breathe properly, you're restless, and the rest of it. They work perfectly for these conditions. However, the reason why you should be careful of these medications is because of their mechanism of action. They are vasoconstrictors. They work by narrowing the veins that supply your nasal membrane, leading to decongestion of your nasal region. So that helps you to breathe properly and perfectly. However, while they are decongesting your nasal region, they also narrow veins that supply other areas of your body. And this is the reason why your blood pressure spikes when you are on these medications. So if you are hypertensive, you may want to skip medications that contains pseudoephedrine or phenylephrine. Discuss with your medical provider. They're going to give you options such as diphenhydramine, which do not really narrow your blood vessels. Number 2 are your NSAIDs, the non-steroidal anti-inflammatory drugs. These medications are wonderful for taking care of pains and inflammation. They include your diclofenac, your ibuprofen, your naproxen. A lot of us are very conversant with these drugs. We take it for pain conditions such as rheumatoid arthritis, for back pain, for knee pain, and for any sort of pain at all. These medications, while they are taking care of those pains, they also work on the kidney to prevent sodium excretion, leading to sodium and water retention in your body. This directly increases your fluid volume and has a direct consequence on your blood pressure. So if you're wondering sometimes why your father, your mother, or you are taking your BP medications and yet the BP is not coming down, you may want to also look at the other medications that they are taking if you have something like NSAIDs as one of their common medications. So you may consider discussing with your medical provider to get other alternatives for you to take care of those pains while your BP is under control. Number 3 are your antacids, those suspensions that you take when you have heartburn. Antacids with high sodium content has been shown to cause an increase in your BP because that extra sodium content on it is not your friend if you are hypertensive. So you may consider going for antacids with low sodium content, as these may give you the results for the heartburn without necessarily spiking up your blood pressure if you are hypertensive. So the fact that these are over-the-counter medications doesn't really mean that you should walk into the pharmacy, request for it, and self-medicate on it at will. Always ensure you discuss with your healthcare provider to make sure that the medications that you are taking are something that you can take based on your medical condition. Stay safe, stay informed, and follow us for more health tips.